Good evening, everybody. Thanks for being here tonight. My name is Stacy Allness, and I work directly for Medica, and I am the account rep on the Education Minnesota plan. So with that being said, we got a lot of information to cover today. So we are going to go ahead and get started. So the plans that we are going to talk about today, like Tim said earlier, they're Medicare cost plans. So with Medicare cost plans, you retain your Medicare benefits. You don't assign them over to Medica. But in order to be eligible for the Medica Prime Solution cost plans that we're going to talk about today, you do need to have your Medicare card with both Medicare Part A and Part B on it. You have to continue to pay that Part B monthly premium, which is either taken out of your Social Security check or you pay by invoice quarterly if you're not drawing Social Security. And then with all Medicare cost plans and all Medicare Advantage plans, there is one underwriting question, and that is you cannot have end-stage renal disease prior to enrolling in our plan. If you get it while you're on our plan, you're going to have great coverage. We won't kick you off. You just can't have it prior to enrolling in our plan. And then with our plans, you must reside in the Medica service area. So as you can see, we have all of Minnesota on our service area. We have all of South Dakota except for one lonely county called Hyde County. So has anybody ever been there? Me neither. So I have no idea what it's like. Maybe they have more cows than people. I'm not sure. If hopefully none of you live there, because if you did, then you wouldn't be able to enroll in our plan. But so every county in South Dakota except for Hyde County, we have most North Dakota in our service area, and then we have 13 counties in western Wisconsin that are in our service area as well. So as long as your permanent residence is within one of these counties, you are eligible for our plan today. And while you are in the Medica service area, it is important to see providers that are in the Medica network. And we do have majority of the providers that are in our service area are in the Medica network, which includes the U of M, Fairview, Park and Nicholas, Alina, Mayo, North Memorial, Healthy. So we do have majority of those providers in the Medica service area are in our network. And the great thing about these plans is that you don't need a referral to see a specialist. So if you were deciding, you know what, I want to go to U of M and get a second opinion, or I want to go down to the Mayo Clinic and get a third opinion, you don't have to contact Medica, ask us for permission to get that referral, and you don't have to contact your primary care doctor to get that referral. As long as the provider is in the Medica network, you can see whoever you want with any sort of referrals needed. And if you're somebody who likes to travel outside of the Medica service area but still within the United States, we have great travel coverage as well, where you can be out of the Medica service area up to 9 months out of the calendar year and still receive the same level of benefits as if you were in our service area. So just because you want to go to Florida for 6 months or Arizona for 7 months does not mean you're going to pay more for your coverage. You will pay the same. The only stipulation while you're traveling outside of our service area is that you do need to see providers that accept Medicare assignment. Because while you're traveling, Medicare pays as primary. Once Medicare has paid their portion of the claim gets crossed over to Medica, and we pay as secondary. So that's the only stipulation while you're traveling outside of our service area, but still within the United States. And if you're somebody who likes to travel outside of the United States, with the original Medicare, that's where your benefits stop. But Medica does go above and beyond original Medicare, and we will reimburse you for any emergencies occurred while traveling outside of the United States. So we do go above and beyond original Medicare. So now we're going to talk about the 2 different plan designs that Medica has available through Education Minnesota. So the first plan type that we're going to talk about today is our high option plan that has a group number of 70123. And so as you can see, that has a monthly premium of $300 a month. With this plan, there is some cost sharing for office visits, outpatient hospital, inpatient hospital, but that cost sharing is fairly minimal. And with this plan, it also offers you a very low max out of pocket of $1,000. So if you are somebody who, tends to go to the doctor more often, maybe has an upcoming surgery, where there's going to be some aftercare and therapies and things like that, maybe this is a good option for you because it has that low max out of pocket. And this is also a plan that covers that prescription drug coverage through the donut hole. So as Tim was talking about earlier, once your medications exceed that $37.50, you fall into the donut hole. With our high option plan, you will continue to pay these amounts through that coverage gap. So you will not be subject to the 44% cost sharing for generics and 35% cost sharing for brand name drugs if your medications exceed more than $37.50. Once you hit that catastrophic coverage, which very, very, very few people ever do, I think that it's maybe less than 6 or 7%, you would be subject to that 5% coinsurance for your medications. So the high option plan, you're paying more for your monthly premium, but it does offer you that security blanket of having a low max out of pocket and that coverage through the donut hole for prescription medications. Next, we have our lower plan option, which is 70125. And as you can see with that plan, it has a lower monthly premium of $138. This plan also has cost sharing for doctor's visits, outpatient hospital, inpatient hospital. But once again, the cost sharing is fairly reasonable. But the big difference between the high option plan and the lower option plan is that this plan has a higher max out of pocket. So the max out of pocket is $3,000. And with this plan, once you hit that coverage gap, you are going to be subject to that coinsurance. So you'll continue to pay these amounts while you're in level 1, but once your medications exceed more than $37.50, you will fall into the donut hole, the coverage gap like Tim was talking about, and you'll be responsible to pay for 44% of the cost of your generic medications and 35% of the cost of brand name medications while you're in that coverage gap. So you're paying more for you're paying less for your monthly premium, but there can be more out-of-pocket expenses with this plan as far as the prescription drug coverage and the max out-of-pocket. But with both of these plan options, we do have an eyewear and hearing aid reimbursement. So on our high option plan, we will reimburse up to $150 per calendar year for eyewear. On our lower plan, it's $75 per calendar year for eyewear. You can go and get your glasses, contacts, lenses, frames, wherever you'd like, pay for them, send Medica a copy of the receipt, and we'll send you a reimbursement check in the mail. Same thing with hearing aids. On our high option plan, we'll reimburse up to $500 per calendar year. On our low option plan, we'll reimburse up to $400 per calendar year for hearing aids. Works the same way as the eyewear. You can go and get your hearing aids wherever you'd like, pay for them, send Medica a copy of the receipt, and we'll send you a reimbursement check in the mail. With our Part D plans, both of our Part D plans, they're embedded with the medical. So like Tim said, do not enroll in a standalone Part D plan because it will cancel you from everything. But with both of our Part D plans, they both use the same formulary. So you don't have to figure out which plan option you're taking based on our formulary because both plans use the same formulary. And you can view Medica's formulary on our website at medica.com. You can also view it on Medicare's website at medicare.gov. Or if you prefer to have a hard copy, we can get you that hard copy as well. Otherwise, you can find all that information on our website as well as our provider information as well. And with our Part D plans, we do have a mail order pharmacy through CVS Caremark where you can get a 3-month supply for 2 months copay. So if you know you're on some maintenance medications, you're not getting off them anytime soon, feel free to get them through the mail order and save yourself a copay every 3 months. But if you're somebody who likes to go to the local pharmacy because you like the convenience of it and, you know, once you're at Target and just pop in, pick up your medications, you can also get a 3-month supply at any local pharmacy as well, but you're going to be subject to 3 copays. So you can still get a 3-month supply, but you'll have 3 copays. The mail order is where you see the discount. So now we're going to talk about some of the value-added benefits that go along with our plan design. So the first one is our fitness benefit. And our fitness benefit is through Silver Sneakers. And so with Silver Sneakers, this is a free membership at any of the clubs that participate with Silver Sneakers. And there are lots of different clubs that participate. YMCAs, YWCAs, community centers, LA Fitness. And the great thing about Silver Sneakers is that you can belong to more than one club at a time. So once you enroll in a plan with Medica, you are going to receive a Silver Sneakers card in the mail. And that will allow you to go to different clubs. So if one day you want to go work out with your friends at the YMCA, but the next day you want to go to Anytime Fitness because that's close to your house and convenient, you can pop into different clubs through Silver Sneakers. And this is also a national program, so if you are somebody who likes to go hang out in Florida during our nasty Minnesota winters, you can go to their website, plug in the zip code wherever you plan to stay for an extended period of time, and look up the clubs that are by where you plan to stay. So there are clubs nationwide, so you can continue your fitness while you're hanging out in a warmer climate. And there is no, you don't have to go 8 or 12 times a month to get this benefit. Once you enroll in our plans, it is a free membership, and you will get that Silver Sneakers card in the mail right away. We do also have a 24-hour, 7-day-a-week registered nurse line, as well as a 24-hour, 7-day-a-week personal health advocate line as well. So what the health advocate is designed to do is just to help you navigate through the often complex healthcare system. They're there to make your life easier. So if you need help scheduling some doctor's visits, or if you need help finding a new provider that's accepting new patients, they can help you do that legwork for you. And I really do recommend this service because our members that use the personal health advocate really rave about the wonderful service that they receive. And then we do also have a personal plans portal out at mymedica.com. It is a secure portal. So you just go out there, set up a username, password, and then you can track your claim information. There's pharmacy resources out there. You can order a new ID card if you lose your ID card. So it's all sorts of different information out there. So we've talked a lot about information today. If you are interested in joining Medica, I do have kits available back there. So feel free to stop, pick one up. There is a summary of benefits in the kits, which goes through the different plan designs. Choose the plan that's best fitted for your needs now, because remember, you're never locked into any one of these plan designs forever. You can always make a change every year during this annual enrollment time. So there are applications included in the kit. Fill out the application, submit it in the return envelope to get enrolled in this plan. So once you get enrolled with the Medica plan, we send you out an acknowledgement letter, an ID card, a member packet, a verification and confirmation letter in the mail. And then this is what your Medica ID card will look like once you get enrolled with a Medica plan.